you were actually pre-diabetic at one point.
Yes,
So
yes.
talk about the diet and lifestyle that led you there, finding that out, and what you did to get to where you are today.
Thank you for bringing that up. I do want to disclose that in my book so that people know that, I'm not preaching from some perfect pedestal. I've been there, and maybe I didn't get so severely sick, but I was on the journey to that, and I just didn't want that to be my outcome. But what happened was, and I have to be very honest, I was not aware of low carb in 2013 when I got pre-diabetes. I was eating a lot of carbs, actually, and that had been my, food pattern for more than 3 decades. I just wasn't aware. Being an endocrinologist did not teach me about a low carb way of life. Um, what came up was in 2013, I was going through multiple inputs of stress, and we had moved from the US to India. I was taking time personally, professionally to adjust to this new life, and I was struggling to cope. And a series of, problems just came up, and 2013 was my year to be maximally stressed out, and my HbA1c reached 6.3. And I didn't have knowledge of until then how to manage my negative thoughts, negative thinking, or deal with the fact that the world's not giving me what I want, and I'm done being unhappy. So, am I going to keep insisting for the world to not, for the world to dance to my music, or am I going to change what I can change? So that was my transition point. I wouldn't say that I magically went into low carb straight after that, but I did change my thinking patterns, my stress. So my chronic stress started to get better. I started exercising. And slowly from 2014 onwards, as this patient was also in my life, I started applying low carb in my own life and realizing and connecting more dots. So there was a whole awakening period that happened from 2013 and over the coming years to now. I went ahead and became a personal trainer. I got trained in multiple forms of meditation. I got trained in mindful eating and emotional eating and helping people heal their relationship with food and with their body. Because I realized negative self talk, negative beliefs, limiting beliefs can really affect behaviors. And I was all about behavior change and in diabetes. And all these learnings just started to come together where I wanted to really help people change, at least the ones who want to change or who've decided, I need a guide. I want to change and I need a guide. I always hope that I could be that guide for whoever is looking for that help.
So we've talked about the stress piece, but I want to go deeper into this. And this was part of your story. I think it's easy enough through our explanation there for people to understand when it comes to diet, how it can lead
Yeah.
to this metabolic disruption. But let's talk about physiology wise stress and
Mm.
its connection to insulin resistance.
Yes. Cortisol, again, being a good friend of ours, it's an important hormone. It's the stress hormone that we know of. And the mistake people make is they'll go do a blood test for cortisol levels and to check, oh, I'm so stressed. Let me show it to my family that look how much stress they're giving me. See, it's in my blood test. It's not like that. It's not easy to measure stress on a blood test. So when you're testing cortisol, you're really testing for disease states, but stress in itself, raising cortisol, may not reach disease levels of cortisol that can be captured on a blood test. But you could still be having all the harms and damages of chronic stress even before it's showing up on high cortisol in the blood. What do I mean by that? What does cortisol do? Cortisol normally, its job is to briefly, if you're running from a tiger, right? Now it's not a tiger anymore. It's that boss, or it's that promotion, or it's that loan that I'm defaulting on, or my relationship, or something that's not working for me, and the world's not giving me, and it doesn't go away. I carry those tigers in my head wherever I go, right? And so this, I'm not letting go of my foot from the accelerator. I'm just smashing down on cortisol, cortisol, cortisol. Now, short-term cortisol is life-saving. It bursts you into a brief burst of energy, gives you a burst of glucose. Why? Because you're clearly in a fight, flight, fright mode. There's something very difficult happening. There's an avalanche coming at you, a tiger coming at you, or you're chasing your next meal and you need to capture it. So you need that burst of energy and that surge of glucose that comes in to help your muscles get that extra, energetic jump, or that energetic, attack, whatever it is that you're trying to do. And that usually lasts for just seconds or minutes at the most. We're not really marathoners in terms of doing these life survival exercises. It's supposed to be brief. And in brief situations, the cortisol situation works. But not letting go of the accelerator on cortisol, now you're looking at high blood pressure, depression, high glucose, diabetes, bone loss, ulcers in the stomach. There's so many things, skin getting weak and thin and papery, bruising. There's just too many problems that can come from high cortisol just because we're chronically stressed. Difficulty losing weight too.
And we did talk about stress, but I want to make sure we cover management of that, which is this wheel. For somebody that comes to work with you, they're under a lot of stress chronically. What are the basic stress management modalities, say, you'll have them work on early on to help dissipate that?
Yeah, I'm so glad you asked that. Somebody may come into me for a medical problem, is diabetes, hypertension, obesity, polycystic ovarian syndrome, right? Their lipid panel. And they don't expect me to get into stress management because they're like, she's not going to talk to me about my mood or my feelings. But I know from my own journey how relevant it is to physical health, right? Mental health being relevant to physical health. And so I wanted to normalize it. I wanted to normalize the fact that it's okay for us to acknowledge that stress could be making you sick, and it's okay to take help. People feel a stigma sometimes, like it's weak or it's not good to take mental therapies. And I want to normalize that. So they might have felt that if I went and saw just one out of the blue a mental health professional, that's more stigma like more obvious. But if under the roof of my services, if I could provide a session with an in-house therapist, it might just count as, oh, there's one more session going on, and maybe they get the resources they need. So we have a therapist. She's a hypnotherapist and does a bunch of mind body guided meditative practices, inner child work, like I said, hypnotherapy. She's even into Reiki. She's a Reiki grandmaster. Whatever it takes to help someone get in touch with any negative emotion that's maybe unconscious, maybe subconscious, old trauma that's been stored away, and we don't know that it's interfering with my happiness or interfering with my rational decisions. Sometimes it's like self-sabotage, in fact. Like, I know I should do this for my health, but I just do something else and something takes over me. This is the classic way someone may describe it is, I don't know what comes over me. I just lose the plot sometimes, and they feel frustrated about themselves. And I want to normalize that is, hey, that's how the human mind can work. It's okay to take help for that. So I sometimes try and package that within my own program so that people can get started without knowing what they need to do, is just show up for the session and it'll get guided from there. But there are so many modalities. So if they know what type of therapy they're okay with, then I can refer them out for those things. Some people are okay with reading a spiritual book. And it doesn't have to be about God. It could just be about getting in touch with yourself and knowing yourself better. Forgiveness is a big one, huge healing that can happen, and letting go of bitterness helps the body to calm down. It's amazing how much sickness comes from chronic stress.
And to me, there's different aspects to this where if somebody's under chronic stress and say it's a relationship in their world or a job, assessing and getting to the root of those, and then the modalities as well. Because if we're just going to the modalities, whether it be meditation, Reiki,
Yeah.
but then we're going to a job we hate every day and that's stressing us out, to me, we need to address both of those to really have the change.
I agree with you. And that's the important balance is, let's say it's my friend, and let's say they are stuck in a situation that's really toxic. And I'm telling them, this situation is so bad for you, just leave, right? That can sometimes hurt the person. It's almost like logically they know they should leave. It's obvious. And yet emotionally, they're somehow struggling. They're not confident. They're feeling addicted to this cycle of toxicity. There's something that keeps them stuck and trapped in that vicious, whirlwind of stress. So it's chicken and the egg, take the rational step of getting out of that situation, or are there self-sabotaging emotions that are keeping you there, that are, not allowing you to take that obvious logical next step? And so I don't ever want to make a person feel like they're more crazy, like, oh my God, I'm so crazy. I'm not, it's so obvious, right? Because that can be the risk, is that they shouldn't feel bad. Like, why can't I get out of this? And so if you don't mind, I'm going to spend a minute on this. Is I got trained in another coaching technique. It came from the world of addiction. And the doctor who wrote the foreword in my book, he's one of the co-founders of this coaching technique that came from the addiction world. It's called motivational interviewing. And what it was meant for was people who struggled with substance abuse, who were falling away from society, could not come back to their jobs, could not come back to, meaningful relationships because of some addiction. And healthcare world workers had almost like written them off, is they don't want to get better, they're just addicts. And they were called the most difficult patients. And fast forward now, we live in a world where you have weight loss drugs that are being told can help with addiction. So we have now drugs that are being marketed to us as, treatments for addiction. But the coaching technique is very interesting for me. Is, let's say someone's addicted to, or let's not use the word addicted to. Let's say someone is stuck in a toxic job, right? And if they would just leave, their diabetes would get better. And it's obvious, right? It's obvious to me as their doctor. It's obvious as their coach. Is, dude, friend, just leave the situation. Your stress would go away. If I say it like that, it sounds as though I know what's best for them and I'm telling them that. What I want to do in motivational interviewing is a coaching style, talking style, or listening style is, it looks like you're stuck. You obviously have two needs. You have one need that keeps you in this job. Maybe it's the money, maybe it's the security, maybe it's the embarrassment of not having a job that keeps you there, even though it's so bad for your mental well-being to be in that office. And there's another side of you that knows that this chronic stress is making your diabetes worse. And you have valid needs on both sides. That's why you're stuck, because you're trying to take care of both things. Right now, you feel like it's either the job or my health. I cannot have both. I cannot have a good work life and good health. That's not possible. And the job of the coach then is not to tell the person what to do, but to come into this conversation with this inherent trust. Is, this client, this patient wants to do well in life. That's why they're talking to me right now. That's why we're in this space together, is because they want to thrive. They want to have a good life. They just maybe don't know how. Maybe they're stuck. And just by acknowledging that and saying, I see you, I'm not judging you. I see that you have these two needs. You're staying in this situation. When you just create that open, safe, non-judgmental space, oftentimes the wisdom kicks in for that person. And there's a technique in that, how you say it. So let me show you 2-3 different ways, if you don't mind.
Please.
Okay. So I'm going to say it 4 different ways. Okay. So you want better diabetes, but you're stuck in that job. Okay. That's one. Or you want better diabetes and you still stay in that job. Or you stay in that job and you want better diabetes. Or, fourth one, you stay in that job, but you want better diabetes.
I like the last one.
The last one? So I'm glad you like the last one. The one right before that would be my top choice. And I'll show you both because it's hard for you to remember all 4 options.
To me, it
like
was
that.
between the two. Yeah, the first two
Yeah.
seemed like no.
Yeah, those were horrible, right?
Yeah.
Okay. So let me tell you why the first 2 were horrible. And you instinctively knew that because you wouldn't want to be spoken to like that, right?
No.
So what's wrong with the first 2? The first 2 put the goal first, is you want better diabetes and you're stuck in that job. So I'm actually putting a question mark at the end and my voice is going up, and you're stuck in that job. Like, I'm judging you, like, how dumb are you? Right? Right? Or I start with You want better diabetes, but you're stuck in that job. The but. So if you know, I spend a lot of time in Chicago, and there's Second City, this stand-up comedy called Second City. They have a book called Yes and. And the idea of improv comedy or stand-up comedy is, if Jesse says to Roshni, the sky is blue, or no, if you say the sky is green, I'll say yes. And it's raining apples today. So yes and is, you said something completely outrageous, but it's improv. So by me saying yes and, I'm keeping the conversation moving forward. I'm not dropping the energy. So and is very important compared to but, right? So the first two you didn't like because I was either sarcastic almost with the way I toned my voice, or I was putting but. Now, this last two, you liked them better because it ended with the desired thing. So it's like musical, you know, that game in childhood where there's a toy like a ball and the kids are sitting in a circle and the music's playing and someone's not looking and they have to turn the music on and off, and whoever's stuck with the thing at the end is out.
Yeah.
So you're passing this thing on, you're passing the baton. So if I'm talking to you, you're most likely to remember the last thing I said because it's the most recent thing you heard. So do I want you, if you're my client, do I want you to hear the change thing that you're interested in, or the stuck thing that you're stuck about?
The change.
Yes, because then you'll take that as your starting point to talk. So when I say you're stuck in that job, but you want better diabetes, the but is a bit of a down energy. But if I say the best choice would be you're stuck in that job and you want better diabetes, period. There's no sarcasm at the end. There's no, interrogation voice. I'm stating that I see you. And I'm ending with, and you want better diabetes. And I'm leaving the space open. Mic's yours. You get to speak. So if we come back to this whole topic of stress management, the inherent starting point as a therapist or as a coach or as a lifestyle doctor is, I trust that this person has wisdom. They know what's best in their life. They know the reality once they leave my office or my appointment. They know the reality best about what they have to do there. So I have to bring in that expertise. This is a meeting between two experts. I'm the diabetes expert, and they are the expert in them, in their life. And honestly, a lifestyle disease is going to be solved mostly by them, not by me, in their life.
So it sounds like a big part of this is not talking down to the patient and trying to get them, while watching how you language things, to come up with the solution on their own.
Yes, and there are trainings. This is like lifelong training, how to do that, how to be more effective as that facilitator and guide for them is the kinds of sentences you use is things like, how important might you rank this on a scale of 1 to 10, 1 being least important, 10 being most important, and then they'll give you a number. And then you'll say, oh, that's a pretty high number. Why did you choose that number and not a lower number like a 2 or a 3? When you're doing that, they're spending the next few minutes talking about why this thing matters so much to them. Change, why change matters so much to them, because they came in stuck, and you're trying to help them move more into change talk. And the statistics have shown, and they've done this, the clinicians who were from the addiction space, they recorded these interviews and they monitored these patients who had addictions who walked out, and they saw that if you have, like, let's say you have a 10-minute conversation, whatever minutes that were spent by the client talking about change. So the more minutes that the client spent talking about change, those were the ones that went out and actually made the change. But imagine if I, sabotage that meeting, that me as the smart doctor with the degree on the wall, I'm the one talking about change. Then it's less likely that they're going to change because I'm preaching at them. I'm not helping them talk about change, because we tend to like the sound of our own voice. We tend to like hearing our own thoughts aloud. And maybe my life was so muddled and hectic, and just coming into your, office, your consultation, I finally got time to think aloud about why this matters so much to me. And I get pepped up about why I want to change. I'm more likely to stick with that when I leave. So there's a structured, method of what types of tools you can use. There are books and books, and there's yet 40 years of research gone into this training method.
The majority of the people tuning in today, unfortunately, aren't going to have an interaction with somebody who is skilled at this, but are there high-level points from the tactics you're talking about that they can use when talking to themselves to help facilitate change?
Yes, let's definitely give your listeners that today. Is if they feel stuck, then can they start writing down their valid needs? Is I eat cookies late at night. Okay, there's got to be a valid need why you're doing that. It helps me with my stress. It helps me with that boss that I can't talk back to. It helps me with this marriage that's not working out. And you have other valid needs, which is I want my diabetes to be fine. So put down your opposite needs that are fighting with each other. Is I'm having the cookies, they're helping me with emotional eating, but they're not helping me with diabetes. So put those valid needs down. Okay. Check your self-talk, diary, journal. Write down what you say about yourself, because whatever you say about yourself, it's going to be true. I am capable of doing this. You're right. I'm not capable of doing that. You make it right when you start talking like that about it yourself, because you're going to be the one who shows up. So monitor your own self-talk. And there's actually a piece in my book about this. I spent quite a bit of pages on this, is check your self-talk. And the nutrition chapter, we talk about how clean is your diet. In the stress management chapter, I have a subchapter called How Clean is Your Thought Diet? What are the thoughts that you're feeding yourself? Because most of us don't even notice the amount of chatter that we're doing in our heads all day. Like, I mean, I know I'm always a recovering neurotic person. I'm like perfectionist and always trying to be everywhere at the same time. And so sometimes when I listen to my thoughts, I'm like, oh my God, calm down. Like, there's too many thoughts. Like, slow down. Listen to yourself. Are you limiting yourself? So another example, I always give up. I always give in when my friends take me out to dinner. I always end up eating the worst thing on the menu. I never stick to my diet. These words of always and never are lies. There's nobody who's always anything or never anything. So I'm being dishonest to myself about myself. I'm putting myself down. So when you start catching this, you might notice how your own thoughts are not helping you. And then there are methods that I talk about in the book, but it's also about identity. And I borrow this from James Clear. He has this book called Atomic Habits, a fantastic book. It really helped me. And the identity is, so there's this thing called sweet tooth, right? So sometimes patients will tell me, I don't have just one sweet tooth. I have 32 sweet teeth, all of them. I got all, right? The full set. And think about that. If you're saying that, is that your identity? How does that make you feel? It's okay to joke about it when you're being humorous, but if you're in a doctor's appointment, you've got uncontrolled diabetes and you're saying over there, I have 32 sweet teeth, you're making a statement about your identity. How does that make you feel? Does it make you feel good? Or does it make you shrink? Does it make you expand? Or does it make you feel small? And chances are you might find that I have some thoughts that make me shrink, you know? Um, and those are the opportunities, is can you help yourself out talking to yourself more kindly? Like if this was your own best friend, would you talk to them like that? If this was a child, a small child who needs motivation, would you talk to them like that? And most of us know, no, 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 I would not do that, right? So this could be the starting point. Some people are able to self-correct and get out of it. And some people, it's okay to find professional help and do this. I've taken years of professional help for myself. I would not have been able to articulate these things had I not done over a decade of self-work. After that 2013 crisis in my own life, it's been over a decade of self-exploration to know what these things are and how my mind works. And, same, you see it in other people and other people benefit from it. And so, you know what, there seems to be some truth here.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The majority of people walking around with metabolic ill health, they don't have any signs or symptoms. They feel fine. I was not aware of low carb in 2013 when I got pre-diabetes. I was eating a lot of